Well, good morning, Chair Murray. I thank you for working on with me on this hearing. I'm glad that we're coming together today in a bipartisan effort to discuss the crucial role child care plays in our economy. Bottom line, Americans can't wait and they can't work if they don't have safe, reliable care for their family. I hope rather than partisan reconciliations processes that you and I can listen to each other's ideas and work together on meaningful solutions in legislative form that stabilizes and strengthens child care and respects and honors parent choice in the care of their young children. I remain committed to seeking workable bipartisan solutions on child care, beginning with my partnership on this committee with Senator Mikulski. We passed significant health and safety reforms to the Child Care and Development Block Grant Program in 2014, a program that had gone almost 2 decades without reauthorization. And for the last few Congresses, Senator King and I have been working on the PAC Act, a bipartisan bicameral proposal to make child care more affordable for families. I look forward to hearing the experiences from our witnesses today, and I thank you for being here to offer us ideas for building a better child care program that works for parents, children, providers, and employers. I want to first highlight and thank child care providers as the one education sector that's never abandoned working parents and their kids during COVID. Child care understood, even in a pandemic, many jobs can't be done remotely, and that parents have to have a safe and reliable place to leave their children so they can work. To maintain stable employment or participate in an education or training program, parents with young children absolutely have to have child care. Breakdowns in child care result in parents leaving work early, being late to work, missing a shift or a full day of work, and being distracted while at work. This leads not just to workers missing out on income and promotions, but incredibly lost productivity for employers. While COVID stay-at-home orders forced Americans to work from home, nurses, EMTs, firefighters, grocery store clerks, and all other essential workers had to be on time each day and every day and not distracted. Child care understood this. Throughout the entire pandemic, child care stayed open to care for the children of other essential workers for almost a year before schools and their unions even got around to figuring out child care implemented numerous enhanced health and safety protocols that, by and large, even in the absence of vaccines, kept children safe and staff safe. And when K through 12 closed its doors to students, child care, in addition to caring for children birth to 5, opened up for the school-age children who needed a safe and supportive place to do their online learning. A key lesson learned from COVID-19 is that K through 12 has a great deal to learn from the child care industry. Staying open during the pandemic has come at a huge financial cost to providers. Even before the pandemic, providers operated on a razor-thin margin. Additional staff and supplies to implement health and safety protocols, on top of recurring fixed costs and in an environment of significantly reduced enrollments, ensured that everyday child care remained open. It was operating well into the red. In the last year, in 3 different bills, Congress has provided approximately $50 billion in emergency child care funding to stabilize providers financially so that as parents return to work, child care is available to them. As of today, we have limited to no insight from HHS as to how states plan to use the majority of these dollars and what effect these dollars are having on providers being open and parents being able to find and afford reliable care that meets their needs. As we look to build a stronger child care sector for the future, I think understanding how this incredible influx of new dollars is being used is absolutely crucial to policymakers. We also need to understand how the flexibilities given to states to support both parents and providers during the pandemic might best be continued on an ongoing basis. We need to continue to allow states to more quickly respond to the unique needs that they see on the ground rather than waiting for a national emergency or the hopes of a reauthorization happening on time. Most critical, however, is that we understand that we understand parents want and needs for childcare going forward. I cannot say it enough. Parent choice and flexibility is paramount. Nothing is more personal than the choice a parent makes of who will take care of their infant, toddler, or 4-year-old. Because children develop on different timelines, parents may prefer one type of provider for one child and another type of provider for another child. And we need options for parents to meet their schedules. One size fits all does not work in childcare. Parents, not government, know their children best. Whatever we do in childcare policy, we must respect and support parents' choices. Additionally, it's essential we understand any unintended consequences of good meaning but poorly thought through policy ideas that may drive up childcare cost and make it more difficult for providers to operate and enter the field, or make it even harder to attract and retain a qualified workforce. As just one example of potential unintended consequences is a poorly designed universal pre-kindergarten program. Pushing 4-year-olds out of developmentally supportive community child care programs and into an already poorly performing K-12 system runs the risk of disrespecting the wants of parents, significantly driving up the cost of already expensive infant and toddler care, and setting young children back in their social, emotional, and academic growth. We presently have a rich and diverse mixed delivery system for child care and early education in this country. Centers, family child care homes, for-profit, nonprofit, religious, large, small. As we look to improve access, affordability, and quality in child care and stabilize and better support a labor-intensive, thin-margin industry, we must do so in ways that build up the things we have right, respecting parents' choices in the care of their young children through a rich and diverse mixed delivery system. I hope today is the start and not the end of a bipartisan conversation on how to make child care better for America's working families. I look forward to working with our witnesses, with Chair Murray, and more importantly, all the committee members on an issue critical for working parents and for their children. I thank the chair. I thank our witnesses. I yield back.